Okay, so diving right in, today we're going to be looking at something pretty interesting coming out of Google.
Hmm.
It's called TXGemma. And if you're someone who likes to keep up with the whole, health tech world, this is definitely something you're going to want to know about.
Yeah, for sure.
We've got a report here from TechCrunch that covers this pretty well. They were at some health tech event recently.
Well,
And so I think today we're really just trying to kind of get a sense of what this TX Gemma thing is all about,
yeah.
why it might be a big deal, and how it kind of fits into the whole, using AI to discover new drugs thing.
Yeah, absolutely.
So, maybe we can just start with the basics. What exactly is this TX Gemma thing anyway?
Well, TXGemma is essentially a collection of AI models
Okay.
that Google is calling open.
Okay.
And they're specifically designed for this whole drug discovery process.
Gotcha.
And it's all part of their Health AI Developer Foundations program.
Okay.
And they're slated to release it later this month.
Oh, wow. So this is pretty new then. Yeah.
Brand new.
Okay.
One of the most interesting things about it is that these models can actually understand both regular text, like you and I are speaking,
Right.
but also they can understand the structure of what they're calling therapeutic entities,
Okay.
which are things like, chemical compounds, molecules, and proteins.
So it's like it can understand not just the recipe, but like how the ingredients work together or something.
Yeah, exactly.
Right, it's cool.
So it's not just reading about the drugs, but it's understanding like their actual fundamental makeup,
Right. Right.
which is
Yeah.
really interesting.
Yeah, that makes sense.
Yeah.
And I was reading here that Karen DeSalvo, who's Google's chief health officer,
Yeah.
she said that their goal is to kind of use this to make drug development
Right.
more efficient because, it's a super long and expensive process now.
Right.
So I guess the idea is if you can predict more accurately,
Yeah. Mhm.
how a new drug will work or like how safe it is,
Right.
that could save a ton of time and money in the long run, right?
Exactly. Yeah.
Okay, cool.
But there is one kind of key piece of the puzzle that is still missing,
Yeah.
which is that Google hasn't actually said specifically what the licensing terms are going to be for this TXGemma thing.
Oh, interesting.
So like whether it can be used commercially
Right.
or if researchers are going to be able to customize it and tweak it to their needs.
Okay.
So those details, I think, will really determine, how open this really is.
Right, because open doesn't always mean open, right?
Exactly. Yeah.
Gotcha.
So TechCrunch is actually trying to get some clarification on that.
Okay, cool. So we'll have to wait and see on that.
Yeah, we'll see.
Okay, so I guess, stepping back a bit,
Yeah.
we hear all the time about AI, like,
Revolutionizing everything.
revolutionizing everything, right?
Right.
And drug discovery is definitely one of those areas where it seems like it has a lot of potential.
Huge potential, yeah.
So how does this TX Gemma thing kind of fit into the bigger picture of AI in drug discovery?
Well, I mean, it's definitely part of this, like you said, this broader trend of...
People believing that AI can revolutionize, the early stage research and development of new drugs.
Right.
And Google actually already has another player in this space, right? It's called Isomorphic Labs. It's like a spin-off of Google.
Okay.
But, it's important to remember that I think AI hasn't really been like this magic bullet solution yet.
Right.
There have been some clinical trial failures.
Oh, yeah.
From some of these AI-driven companies like Exscientia and Benevolent AI.
Yeah, I've heard of those guys.
Yeah, they've been around for a while.
Yeah.
And even some of these, advanced AI systems like Google DeepMind's AlphaFold 3, they have, varying degrees of accuracy.
Oh, it's not perfect.
It's not perfect.
Yeah.
It definitely has huge potential,
Yeah.
but it's not like a guaranteed shortcut or anything.
Right.
Yeah.
Okay, but it does seem like there's still a lot of optimism and money going into this whole area.
Oh, yeah, absolutely.
Like, people are still pretty excited about it.
Oh, yeah. I mean, big pharma companies like Eli Lilly and Novartis are even
Wow.
partnering with companies like Isomorphic Labs. And Isomorphic Labs is actually saying that they think they'll start human testing of some AI-designed drugs
This year?
this year.
Yeah.
Yeah.
Wow, that's crazy.
Yeah. And if you look at just like the sheer amount of money being invested in this,
Yeah.
it's over $60 billion so far
Wow.
into something like over 460 AI startups
Wow.
that are all focused on drug discovery.
Okay, so that's like a pretty clear sign that people think
Yeah.
this is going to be a big deal.
You're betting on it big time.
Yeah.
Yeah.
Okay, cool. So I guess just to kind of summarize what we've talked about, this TXGemma thing
Right.
from Google,
Right.
it's basically a set of these open AI models
Yeah.
that are designed to kind of speed up and improve this whole process of drug discovery.
Mm-hmm.
And they do that by understanding, both the text, like what's written about these drugs, but also the actual structure.
Okay. Of these like therapeutic entities, as they're calling them.
Exactly.
And it's a promising step forward.
Yeah.
But it's also kind of happening in this field that has, it's had some challenges in the past.
Yeah, a lot of hype, but
Yeah.
also some setbacks.
Exactly.
Yeah.
So, we'll see how it all plays out.
Yeah.
But yeah, it seems like how open they make this TX Gemma thing is going to be a pretty big deal
Yeah, definitely.
in terms of how much of an impact it has.
Yeah. And it makes you wonder, right? Like,
Yeah.
you've got all this money pouring in.
Mm-hmm.
You've got these big companies involved.
Right.
You've got this push towards open access.
Right.
So what do you think is going to be like the biggest hurdle? Aside from the technical challenges, right? Like, let's assume they can make these models really accurate.
Right.
What do you think is going to be the biggest thing standing in the way of, actually using this AI to create new medicines
Yeah.
that everyone can actually get access to?
That's a good question. That's something to think about.
Yeah, a lot to unpack there.
Definitely. Yeah. Okay. Well, thanks for breaking all that down.
Yeah, no problem.
That was a really interesting deep dive into this whole TX Gemma thing.
Yeah, absolutely.
I'm definitely going to be keeping an eye on this to see how it all develops.
It'll be interesting to see where it goes.
For sure. All right. That's all the time we have for today. Thanks for listening to The Deep Dive.